Hello everyone, welcome back to Constitutional Drug Series. This is Dr. Gayatri, BHMS and REBT counselor. Today we are going to discuss graphitis, which is majorly given for menopausal age group females. It can also be given to puberty age group, but predominantly given for menopausal women. We will go into physical appearance directly. Graphitis patient personality physically is she is obese, she has dark rough elbows, short height, mild nature, there are warts on neck and cracked heels present. Okay, so we will look into what Philip Bailey has written. Graphitis tends to be quite rounded, soft in appearance like that of pulsatilla. Pulsatilla and graphitis, they are very closely related. What pulsatilla is at puberty, graphitis is at climacteric. This is the line given by Dr. Allen. Though there is sometimes squarish look of the face, older graphitis women are obese. Their faces tend not to look bloated but rather rosy, clear. Younger graphitis women are little slimmer but still soft, rounded rather than bony. Then obese graphitis are usually of dark complexion, whereas slimmer graphitis, they are of usually fair complexion. But 80 to 90% graphitis patient is obese and of dark complexion with short height, warts on neck, moles are present, and they have very rough and cracked heels. So this is all about physical appearance. Philip Bailey mentions here that graphitis is simple, gentle, and there is a slight indecision present like that of pulsatilla. She is moody. And then there is graphitis men. They are painfully shy. They have on the whole a much harder time in childhood than graphitis girl. And as we earlier discussed how female looks, moreover so male also looks the same, short, obese, there is roughness of the skin and cracked heels present, eczema or psoriasis complaint, so very well indicated remedy for skin complaints. Other characteristics are graphitis patient is chilly patient. There is leukorrhea before menses, and gushing leukorrhea is main characteristic. It is also given for menopausal complaints and postmenopausal complaints also. Constipation is present along with back pain. So back pain is again a keynote and concomitant of graphitis person. We'll now read first paragraph of boric. Like all the carbons, this is an antipsoric of great power, but especially active in patients who are rather stout, fair complexion, also can be given to dark complexion with tendency for skin affections, constipation, fat, chilly, costive with delayed menstrual history, takes cold easily, children, impudent, teasing, laugh at reprimands, has a particular tendency to develop the skin phase of internal disorder. This is very much important point that William Borick has mentioned, has a particular tendency to develop skin phase of internal disorder. मीन्स अगर कोई इंटरनली ऑर्गेनिक अफेक्शन है और उसी के साथ ही स्किन कंप्लेंट्स उसके बाहर दिखाई दे रही है, सो यू कैन थिंक ऑफ गिविंग ग्राफाइटिस. Eradicates tendency to erysipelas, anemia with redness of face, tendency to obesity, gushing leukorrhea, cicatricial tissue absorption, induration of tissue, duodenal ulcer, and cancer of pylorus. Mind complaints, great tendency to start, timid like that of pulsatilla, unable to decide like that of pulsatilla, want of disposition to work, fidgety while sitting at work, Music makes her weep, apprehensive and indecisive. So how to differentiate pulsatilla and graphitis? First of all, pulsatilla has marked weeping tendency as compared to graphitis. This is one character. Graphitis has very much rough skin and cracked heels, which is not seen in pulsatilla. Pulsatilla is highly thirstless, whereas graphitis you can find thirsty plus thirstless both. Then there is hot drinks disagrees in graphitis. Both are chilly. Again, pulsatilla and graphitis both are chilly. Gushing leukorrhea is very well marked in graphitis, whether it is a puberty age group or menopausal age group. If you ask the question like, do you have any complaints of leukorrhea, then she will say yes, she has profuse leukorrhea as compared to pulsatilla. So this is how we can differentiate quickly. And one more thing is, there is past history, or either in whole of life she must have suffered from fissures of anus. So this is very important confirmatory symptom. Now we'll go to head complaints. Rush of blood to head with flushed face, also with the nose bleed. Distension and flatulence is marked. Headache in morning, mostly one side. There is sensation of cobweb on forehead. So other two remedies are borax and baryta carb. There is sensation of cobweb on face. Feels numb, rheumatic pains on one side of head extending to teeth and neck. Burning pains are there on vertex. Itching eruptions of scalp with fetid odor. Eyes, ophthalmia with intolerance of artificial light. Eyelids are red and swollen, and eczema of lids. And there is dryness. Dryness will be marked all over, as it is a keynote and it goes through all the complaints. So dryness, just remember, every mucous membrane on every part is dry and rough with fetid odor. Ears, dryness of ears, cracking in ears when eating, moisture and eruptions behind the ears. Uh, Hearing is there, which is better in noise. So if any patient is suffering from tinnitus or any acute sensory neural disturbances, then complaints are better in noise. Hissing in ears, then thin white scaly membrane like exfoliated epithelium, fissures in and behind the ear. So it can be given for herpes, it can be given for eczema, etc. Nasal complaints, scabs and fissures in nostrils, and smell abnormally acute. Face, moist eczema around mouth, eczema of nose, itching, pimples are present, burning present, erysipelas and stinging. So these are some of the clinicals. Mouth complaints, sour irritations present, and breath smells like urine. So there is so much fetid and rotten odor present of discharges or from mouth. Stomach complaints, there is aversion to meat, sweets nauseate, hot drinks disagree, nausea and vomiting after each meal. So this is again a keynote. Morning sickness during menstruation, burning in stomach causing hunger, eructation difficult, flatulence, recurrent gastralgia, relieved by hot drinks, especially milk. This is again a keynote to remember, that gastralgia is better by hot milk and lying down better. Abdomen, nauseous feeling in abdomen, fullness, flatulence, there is constipation, fetid gas preceded by colic. It can be given for hemorrhoids, prolapse of rectum, or soreness of anus, fissures, piles, etc. Large difficult stools, constipation is present. Urine is of fetid smell. Female complaints, menses are too late, which is accompanied with constipation, and after that profuse leukorrhea is present, which is excoriating, and there is back pain where there is weakness present. mammy swollen, nipples sore, cracked, blistered. So it can be given for any nipple related complaint also, where there is sore cracked nipples present. Even after lactation there are complaints to females, so it can we can think of giving graphitis over there. Male complaints: sexual debility with increased desire. Aversion to coition in both the sexes is a keynote. Both in females and male, there is aversion to coition at between 40 to 50 age group. In that age group, there is marked of this symptom: aversion to coitus. Too early or no ejaculation. Herpetic eruptions on organs. Respiratory complaints, you can think of giving it in chronic asthma or chronic rhinitis or chronic hoarseness with skin affections. So this is graphitis, male, female, and respiratory complaints. Now we'll move forward to extremities. There is pain in the nape of the neck, shoulders, and back. Spinal pains present, pain in small of back with great weakness, excoriation between thighs, numbness of the left hand, edema of lower limbs, crippled toenails is one of the character. So physically you can see crippled toenails for graphitis patient and cracked rough heels, stiffness and contraction of toes, cracks or fissures in ends of the fingers, offensive perspiration of feet. Skin complaints given for early stage of keloids, rough hard dryness of skin affected by eczema, pimples, acne, eruptions oozing out with a sticky discharge, unhealthy skin, every little injury suppurates, cracks in nipples, mouth, or between the toes. Now we will go to modalities. Patient is worse by warmth at night and during and after menstruation, better in dark and from wrapping up. It is also complementing argentum nitricum, follows well in gastric complaints. So this is graphitis. If you have any doubts, do comment and let me know, we will discuss. Thank you. Bye bye.